Before we start looking at the disease processes for the musculoskeletal system, it will be useful to just quickly go on an overview of the assessment of the musculoskeletal system. I know that some of you covered this in NAM, so we did musculoskeletal assessment in NAM, and also we, for those of you who came through other pathways, would have done this in TBN. So this is just a quick revision lecture. The musculoskeletal system is one of the easiest systems to assess. You start by getting a thorough history. History is important because for musculoskeletal system, much of the problems starts with trauma, and much of the diagnosis is non-specific. So history is really important in terms of trying to build up a case to come up with an initial diagnosis of the patient for where the problem is coming from. Much of the disease processes, we don't have specific tests, for example, to test for conditions such as lupus, rheumatoid arthritis, osteoporosis, or anything like that. So especially in the beginning, when the symptoms are not yet severe, it's very difficult to assess them. So a good health history is necessary. And for patients who come in with back trauma as well, it's quite important to assess, to try and find out where did the problem start, so you can try and pinpoint what is it that is causing the back problem. Is it a degenerative change? Is it a trauma case? So you need good history. You need to assess the chief complaint. You need to know where the problem started. How is it affecting ADLs? You need to assess the location of the pain, the duration, any radiation, and aggravating symptoms, alleviating symptoms. You could use one of those mnemonics that we learn in I9 NAM, such as odd cuts. You need to inquire about fever, fatigue, weight loss, rash, and changes. This can differentiate between problems that are caused by trauma and problems that are caused by disease processes, such as arthritis, osteoarthritis, rheumatoid arthritis, lupus, and gout arthritis. So you need to be able to differentiate between the two, and many of these questions which you generate from here, from getting a good history, will be useful in that sense. So take a good history and then proceed to examine the patient. So as the patient walks into the room, you look at their posture, their gait. This gives you so much information. You remember one of those pictures that I showed you in the beginning of the lecture, that is your head too heavy. That patient was walking in with kyphosis, lordosis. You can actually get much more information by looking at that. So start predicting what sort of problems are causing this. Is it osteoporosis, for example, which is causing this disease? Look at their fingers, look at how they are walking, look at how they sit upright in the chair. Then you proceed to inspect and palpate the bones for visible deformities, tenderness, swelling, warmth, and range of motion. Would be useful as a nursing tip to give patients analgesia before you proceed any further, if you so that you can have a thorough assessment of the patient. Assess and compare corresponding joints, because that gives you a lot of information. If the disease is only affected one joint and not the other joint, that might be a diagnostic feature for arthritis versus rheumatoid arthritis. So you need to be clear about that. Which specific joint is affected? Is affecting both hands. Remember the other picture that I showed you in the beginning, in which you've got two hands which are almost similar in nature. So that tells us something about that condition. Never attempt to move the joint past the normal range of motion, because you might cause damage to the patient. I remember working in ED, where you get some of the patients from those dodgy massage therapists in the shopping centers. So I call that a shopping center syndrome, a shopping center massage syndrome, where a patient comes with a neck sprain or after being massaged in those dodgy places. If you've got the money, please consult a physiotherapist, consult a real physiotherapist, because you might end up with problems. Ability to walk, use of assistive devices, ability to do ADLs. So this again sets the tone for our assessment and sets the tone for the nursing care that we need to give the patient. So grading of muscle strength. You can grade muscle strength from 0 to 5, and 0 being paralysis and 5 being full muscle strength against resistance. And this grading of muscle strength tells us two things. because it gives us information about the strength of the muscle itself and muscle mass, which is an important indicator for the health of the patient. But it also gives us information about the integrity of the nervous system. So the nervous system is coupled with the muscles, and the muscles are coupled with the bones, and the bones are coupled with the joints, and the joints are coupled with the ligaments which attach them, and the whole movement as a unit forms the musculoskeletal system. So by asking the patient to grab your hands as firmly as possible, you assess a number of systems at the same time. Well, this is, I thought I would just put this picture here. This is Rabba Ricci, does a lot of is a contortionist, and he does a lot of contortions and this reading. So basically, to be able to adopt this posture, you have dislocated a couple of joints there. This is you. If you're interested, you can go to his pictures. A UK artist and has been to Australia a couple of times and doing this contortionist. But that tells you how far you can stretch the musculoskeletal system and how far lax the ligaments can become. So range of motion. Now remember this from TBN, and just a quick revision: flexion, extension, abduction, adduction, rotation, internal rotation, and external rotation. Yes, perform this range of motion. Passive, that is the patient is not putting any pressure, and active, with the patient putting as much pressure as possible against the resistance against your hand. So you could do it both ways and assess the joint movement in the movement of the muscles. After this, so you would normally the doctors would ask for diagnostic evaluation, and usually they use a number of techniques to do so, ranging from imaging procedures such as CT scans, bone scans, and magnetic resonance imaging, radioisotopes for bone density scans, endoscopic procedures such as arthrocentesis and arthroscopy, and other studies such as a biopsy for cancer, synovial fluid aspirations for osteoarthritis and rheumatoid arthritis, artherograms and venograms to check the integrity of tissues within joints, and myograph to test muscles, myograph to test muscle strength and electrical activities of muscles. You can also proceed to laboratory tests such as FBE to check for fever, hemoglobin, and myoglobin, presence of myoglobin in the blood, to test for diseases such as rhabdomyolysis. And then you can also check all those other enzymes that are there which can indicate muscle damage. So would be good for you guys to look up these muscles, because these are some of the things that you read in medical notes.